So before we hear from the Minister for Health and the German minister, I'd just like to show you some slides from the Ipsos survey, the CHAM Ipsos survey that you'll be able to see on the site in a few days' time. So 5 countries have been analyzed. The citizens from France, Germany, Poland, Netherlands. So what's interesting is to see that Europeans consider that most often that their healthcare system has gone down in quality, or that it hasn't changed in in the last 10 years. So 40% of the countries believe this. The countries that are the most efficient, we've already said this, are Sweden, ahead of Germany, Denmark, and the Netherlands. So the Swedes at the top of the list there. So collaboration between European Union countries is considered to be very useful in order to improve the efficiency of all healthcare systems in Europe. Inside your country, we're at 86% in terms of agreement, and in the EU, we're at 85% in terms of agreement. Now, in all countries, Europeans agree to the idea of strengthening collaboration between states. This will help healthcare systems to be more efficient. You can improve the level of training, so 86%, to make important savings, 69%, improving management of serious diseases, 85%, better preventing disease, 85%, improving quality of life of patients, 81%, allowing diagnosis of illnesses, 84%, better securing of data, 78%. Now, when you look at what the Europeans are saying when it comes to healthcare data, 8 out of 10, so 78% say it's good to share data. This is a phenomenon that is changing. It was 50% 3 years ago. And then the last slide is also very interesting. Today, 1 European out of 2 is ready to undergo a surgical operation carried out by a controlled robot that is animated by artificial intelligence. So 54% favorable. It was only 20% 3 years ago. It was already 80% in China. 80% of people were quite happy to be operated on by a robot, which really shocked people in the operating theatres. Now, here's a question that I'd like to ask Agnès Buzyn. Should we create a personal patient file for Europe? So it's already a project that we have. It's about connecting Europe facility e-health. The idea is to allow health professionals to access more complete information for each citizen of a member of the European Union. For this, each practitioner will be able to consult a summary sheet that is online and access to electronic prescriptions. This file will provide for better management for all European citizens when they have to move for work or tourism inside the European Union. However, this project is for the medium term. First of all, each country needs to set up national digital systems with structured data to make it possible to have interoperability in Europe. And this is a huge amount of work that needs to be carried out. In France, we already have started this work. We started in 2017. We're going to continue to feed into discussions in Europe as we develop the European healthcare space that we're going to be setting up for each French citizen as part of the Ma Santé 2022 plan.
So now for the German Federal Minister of Health, do you think that we can harmonize medical studies in Europe?
Medical training. However, I believe that our approach to such cooperation should not involve common curricula. Instead, I would like to suggest another approach. You will see why when I describe to you the situation in Germany. Germany is home to 38 medical schools, and about 10,000 new students enroll each year to study medicine. The individual courses of study vary widely from one medical school to another. There's quite traditional courses where the preclinical and clinical parts are strictly separated, and others with a modular design and where theory and practice are more integrated. Medical schools tend to have different priorities. They try out new training formats and forms of examination. Ultimately, however, all medical students sit the same state exam. Therefore, I can imagine a form of European cooperation where we agree on common standards, standards for exams and learning objectives. The course itself should be individually structured. As we agree on these standards, we should focus on the things that matter to ensure patient safety and a high quality of care, so we become better together.
Agnès Buzyn, quelle politique européenne?
Agnès Buzyn, what European prevention policy should be encouraged and by whom? Well, I have been really committed to prevention since the very first day that I became minister. It's a daily fight to control tobacco and to set up a health service in schools, and recently vaccination was made mandatory by law. As the French president recalled last week when he revealed our Ma Santé 2022 plan, all public sectors are concerned by prevention. In Europe, we have had this orientation by financing the coordination of the member states and the drafting of recommendations by the member states. Prevention will be involving joint actions on subjects such as antibiotic resistance and fighting unequal access to care, as well as vaccination policies. However, the weakness of Europe is that it depends on a consensus among the member states to be able to react in healthcare, which is one of the prerogatives of the member states. We can hope that member states are often responsible for the failures in harmonization in terms of pesticides and tobacco, for example. The European Parliament and the European Council are the bodies that must become more involved in the definition of the outlines of a policy for European healthcare in the future. Mr. Spahn, should we create a European agency to assess all of the healthcare products?
Difference between preconditions for placing products on the market on the one hand and those for pricing or reimbursement decisions, such as health technology assessment, on the other hand. Marketing authorization is already centralized for pharmaceuticals. The European Medicines Agency, the EMA, closely together with member states' agencies, ensures that all medicines available on the EU market are safe, effective, and of high quality. For medical devices, there are several directives harmonizing rules for the placing on the market and putting into service of medical devices. This common European work on market access of pharmaceuticals and medical devices is a great achievement. But we cannot compare marketing authorization and health technology assessment. Health technology assessment contains value-based decisions that are informed by politics and society, and also partly involve ethical aspects. Such value-based decisions, which are context-specific, should continue to be reserved for the member states. Therefore, I do not think that the harmonization, even of the clinical part, of health technology assessment is a realistic option, or that we could get a unique European agency for this task. However, I welcome a deeper voluntary cooperation on HTA across the EU. I believe that a well-organized and high-quality cooperation on HTA can support the member states in preparing their decisions on pricing and reimbursement. But the framework conditions have to be right. These framework conditions must guarantee that the ability to decide and the political flexibility in organizing healthcare systems, including pricing and reimbursement aspects at national level, remain fully safeguarded.
Agnès Buzyn,
Agnès Buzyn, can we create European criteria for the relevance and quality of the acts? That's a good question. As you know, the question of quality and relevance of acts, for me, is essential. This is why I've made this topic one of the 3 pillars of the strategy to transform our healthcare system while allowing patients to measure their own satisfaction. This is a dynamics that I want to see across Europe. Today, the European criteria are indispensable for the relevance and quality of acts, just like they can exist for medication and medical devices. Best practice recommendations are often drafted and disseminated at the European level through learned societies. We do also see these quality of practice standards in many directives such as the Euratom directive, recommendations by the WHO as well. There are current reflections that are focusing on clinical results for patients, as well as taking systematically into account patients' opinion. And I think that this should be taken into account for the relevance of acts. James Spann, what is your viewpoint on the subject?
Goal of developing quality standards of medical care. Quality assurance and quality improvements are necessary conditions for a high-performance healthcare system. I'm convinced that the exchange of experience and best practice of quality measures in Europe is very useful. Member states can learn from each other and improve the quality of medical care in their own countries. In Germany, quality assurance is an important part of the system of statutory health insurance. However, legal regulations only provide the framework. It is the responsibility of the self-administration in the healthcare system and not the German state or the Federal Ministry of Health to specify concrete measures and to define quality standards for certain medical interventions. Because of the different healthcare systems in Europe, it would be very difficult and complex to find comparable criteria for a common assessment of quality results. This function should remain national. Since quality assurance is an important part of health system design, it must remain the responsibility of the member states. In the light of the above, a European evaluation agency wouldn't be reasonable.
Agnès Buzyn, pensez-vous qu'une
Agnès Buzyn, do you think a European task force to respond to health crises would be useful to inform politicians minute by minute as to the right decisions to take in emergency situations? Well, a European task force should not replace the countries. Crisis management requires an operational command chain that's robust with good information systems and logistics. However, we should remember that there are measures concerning serious transporter health crises. There is a European Health Security Committee that's been set up, as well as an early warning system. This system allows us to exchange information early on and to manage crises underway. More recently, there is a European Medical Corps that's been set up to help countries within Europe or outside of Europe with humanitarian missions. However, it seems useful that Europe should equip itself with experts who can help a member state dealing with a serious crisis. And we also need to invest in the prevention of these crises by harmonizing our strategies in each state, and an international benchmark would be useful on this question. James Spann, what is your answer on the same topic?
The Union has established structures to combat communicable diseases. The European Centre for Disease Protection and Control, the ECDC, is responsible for surveillance of communicable diseases, scientific advice, and rapid risk assessments, and is operating the early warning and response system. The Health Security Committee is dealing with preparedness, planning, and coordination of response. Together, Germany and France have initiated the European Medical Corps. The Medical Corps is a good mechanism to pool European resources to be mobilized if needed in field missions. As Germany, we have increased the number of experts available on short notice. Nevertheless, recent outbreaks have underlined that specialists to fight outbreaks are still scarce. Therefore, we will continue to upsurge the number of experts, but also expand programs to help countries preventing outbreaks before they occur.
Un mot de conclusion, Madame la Ministre.
A word of conclusion, Madam Minister, for CHAM 2018. Well, with all of the topics discussed, you have understood that we all Europeans have the same challenges. We must have an overarching vision, and yet economies of scale will become an asset. So European action, which often is called into question, will complete the action of the member states by helping governments reach common objectives and meet transporter challenges. The preparation of the Brexit shows to what extent Europe has contributed in terms of the commons. And healthcare is part of a concept of Europe that protects. Healthcare is a growth factor, but it's also a true factor of cohesion. Thank you. Thank you. CHAM 2018 is over. Thank you for your presence.